Lecture number 9. We continue talking about immune system, and on this lecture we're going to stop on immunological disorders. All immunological disorders are divided into two groups: hypersensitivities and immunodeficiencies. Hypersensitivity means immune system works but not right. Immunodeficiencies means immune system doesn't work partially or entirely. And we start with hypersensitivity reactions. There are 4 types of hypersensitivity reactions we have to know. Type 1 is called immediate type or anaphylactic hypersensitivity, or this is what we call allergy in everyday life. Type 2 is called cytotoxic hypersensitivity. In this case, immune system makes antibodies against our own cells. Type 3 or immune complex hypersensitivity reactions. In this case, immune system makes antibodies against antigen-antibody complexes. And finally, type 4, or it's called cell-mediated hypersensitivity, or also it's known as delayed hypersensitivity. Next, we're going to go through each type of hypersensitivity reactions, and we'll talk about their main characteristics. So, type 1, also known as allergy, or we call it anaphylactic hypersensitivity, or we also call it immediate type. Why do we call it immediate type? Because reaction time is immediate or within 20 minutes. Examples of anaphylactic hypersensitivity or type 1 will be insect sting allergy, hay fever, asthma, food allergy. Now let's talk about what type of antibodies will be involved in type 1 hypersensitivity reactions. Immunoglobulin E will be involved. So what it's going to do, when we meet antigen, our immune system will make immunoglobulin E's. Immunoglobulin E's will attach to the surface of the mast cells, and when they trigger those mast cells, they start producing what we call inflammatory mediators. And this is the point when patients start developing symptoms of allergic reaction. Treatment. For emergency cases, we use epinephrine. You probably know that patients that have allergic reactions to a lot of allergens have EpiPen with them. We also use antihistamines to treat those allergies, and also we can use what we call immunotherapy. Type 2 or cytotoxic hypersensitivity. An example of this type will be transfusion reactions, hemolytic or Rh disease of the newborns, and also Goodpasture's syndrome and Graves' disease. Reaction time, as you see, depends on the patient, depends on the type of reaction. So what kind of antibodies will be involved in this type? In type 2 hypersensitivity reactions, immunoglobulin G and immunoglobulin M will be involved. So what they do, they mark our normal cells, mistakenly of course, as targets. It will activate complement system, it will activate phagocytosis. As a result, patients will develop symptoms of disorder. Treatment. Actually, treatment depends on the type of disorder, of type of type 2 reaction, and we usually offer supportive treatment or called symptomatic treatment to those patients. We can use transfusion reaction, for example, to treat transfusion reactions disorders, or we can use exchange transfusion to treat hemolytic disease of newborns, or for example insulin. We use insulin to treat diabetes. Type 3. Type 3 is called immune complex hypersensitivity reaction, and the reason why, because immune system in this case will make antibodies against antigen antibody complexes. An example of this type of hypersensitivity reaction will be lupus or systemic lupus erythematosus, rheumatoid arthritis, serum sickness. As you see, reaction time, the same as in the previous type, is variable. It depends on the patient. And what type of antibodies or what kind of antibodies will be involved in this type? IgGs and IgMs will be involved. So antigen antibody complexes, usually when they get formed, they might get deposited into certain areas of human body. Once again, that will activate complement system in phagocytosis, inflammatory mediators will be released, and as a result, patients develop symptoms of type 3 reaction. And then once again, treatment depends on the type of disorder. Very often we use steroids for treatment of this type. Why? Because steroids actually suppress production of antibodies. Steroids suppress our immune system. And finally, type 4 hypersensitivity reactions. Also, this type is called cell-mediated type or delayed hypersensitivity. Why do we call it delayed hypersensitivity? Because as you see, reaction time for this type will be 12 hours and longer, sometimes several weeks. Examples of this type will be rejection of transplanted organs, poison ivy reaction, TB skin test. What kind of antibodies will be involved in type 4, excuse me? None. That's why we call it cell-mediated type, because no antibodies will be involved in this type. Instead, T cells will be involved in this type. And same, when T cells get activated, they activate macrophages, they secrete a lot of inflammatory mediators, and patients as a result develop symptoms of this reaction. Once again, treatment depends on type of disorder, and once again, very often we prescribe or use steroids because steroids suppress T cell function. Alright, so we continue our lecture, and next we are going to go through each type of hypersensitivity reaction, and we will talk about each type in a little bit more details. We start with anaphylaxis or immediate type hypersensitivity reaction, or as I said, we call it allergy. So let's talk about pathogenesis of this type. On this slide, you see the picture that show you actually what happens when a person gets exposed to the antigen. In this case, we call it allergen. So when a person gets exposed to the certain antigen or allergen, it will activate B cells. B cells will start producing IgEs. Immunoglobulin E's will go and attach to the surface of the mast cells. This stage of allergic reaction is called sensitization. Please remember, on this stage, patients do not develop any symptoms of allergic reaction yet. So, if the same patient gets exposed to the same allergen or antigen second, third, or so on times, then that antigen or allergen will attach to IgEs and will form antigen antibody complexes. Those complexes will activate or stimulate mast cells, and mast cells will start producing inflammatory mediators. At this point, patient develops symptoms of allergy. So once again, let's repeat all characteristics of type 1 hypersensitivity reaction. We call it immediate type because the time of reaction is either immediate or within first 10-20 minutes. We also call it allergy because actually allergens, this is what we call those antigens, stimulate development of this reaction. So as I said, if person exposed to the allergen for the first time, it will stimulate production of IgEs. Immunoglobulin E's will attach to the surface of the mast cells and patient becomes sensitized. No symptoms of allergic reaction yet. But then if the same person gets exposed to the allergen, the same allergen again, those antigens or allergens will bind to IgEs on the surface of the mast cells and basophils and form antigen-antibody complexes. Antigen-antibody complexes will activate mast cells and basophils, and they start producing inflammatory mediators. And those are histamines, prostaglandins, and leukotrienes. So at this point, patient develops symptoms of allergic reaction. Now let's talk about inflammatory mediators that are released during the allergic reactions and what is the mechanism of action, what they actually can do. As you see, histamine, let's start with the histamine. Histamine is actually acts immediately or fast. As you see, it can cause dilation of the blood vessels. It can cause constriction of the upper airways. As a result, patient will develop hoarseness of the voice and difficulty breathing. Because histamine increases permeability of the blood vessels, they start leaking and the person develops edema. Increased permeability of the capillaries in the skin or mucous membranes results in a rash, itchy rash or hives. Lips of those patients usually become large and pale. For the same reason, increased permeability of the blood vessels and dilated blood vessels. Edema of intestinal tract causes nausea in those patients. And again, edema of the larynx again narrows airways and causes hoarseness of the voice. And the last symptom that patients might develop, itching under the chin. Guys, please pay attention. All those symptoms are listed in the same order as they usually appear. But does it mean that all patients that will develop allergic reaction will develop all those symptoms? Of course not. Some patients might develop just one symptom from the same list, from this list, and that is still going to be considered as an allergic reaction. Now, next type, different type of inflammatory mediators is called leukotrienes. You have to remember that leukotrienes involved with asthma, and leukotrienes act slowly. And what they do, they actually cause contraction of the smooth muscles of bronchi. As a result, patients will develop difficulty breathing and very spasmodic dry cough. Also, leukotrienes will increase permeability of the capillaries of bronchi. As a result, patients will develop edema of the mucous membranes, and once again, patients will develop difficulty breathing, and a lot of mucus will be produced as a result of leukotrienes are produced. Treatment. How do we treat allergic reactions? There are two types of treatment we use today. The first type is called short-term treatment, and with the short-term treatment we of course going to use antihistamines, and they actually block histamine by competing for the binding cells and the target cells. Also, we can use epinephrine in emergency cases. The second type of treatment is called a long-term treatment, and also we call it prolonged immunization or allergy shots. What does it mean? In this case, first of all, it's a long-term treatment because it takes a long time, sometimes even few years. And we start with the small doses of certain allergens, introduce them regularly once in 2-3 months into the patient's system. And when we're doing that, immune system of that patient starts producing IgGs instead of IgEs. And because immunoglobulin Gs are not able to attach to the mast cells and basophils and not able to activate them, as a result, patients will not develop symptoms of allergic reaction every time when they get exposed to that antigen in real life. So what does cause the allergic reactions in our patients? Um, we have to remember that everything is actually inherited. If parents of the patient or grandparents had allergic reactions to certain allergens, that means there is a high risk for that patient to develop allergic reactions as well. So basically, it's a structure of immune system that is inherited. Now, allergic reactions caused by antigens. We call them allergens. Let's talk about different types of allergens that actually can cause allergic reactions. They all can be divided into few groups. The first group, those are inhaled allergens. They can cause upper respiratory tract allergic reactions and lower respiratory tract allergic reactions. As an example of upper respiratory tract allergic reaction, we can use allergic rhinitis or hay fever. The most common allergic disorder, we have usually a lot of patients with these allergic reactions in the spring when everything is blooming. So in this case, allergen or antigen attaches to the mast cells on the mucous membranes of the nose and upper respiratory tract. Inflammatory mediators will be released, and as a result, patients develop swelling of the mucous membranes of this area. A lot of mucus will be produced, itching. Example of lower respiratory tract allergy will be asthma. Just remind you, histamine is not involved in asthma. Instead, leukotrienes are involved with asthma. And that explains why we do not use antihistamines to treat asthma, because they won't work. So asthma, it's a breathing disorder, and patients develop symptoms of asthma because leukotrienes are released, and they cause contraction of the smooth muscles or bronchi, swelling of the mucous membranes of the bronchi, and a lot of mucus will be produced. As a result, patients will develop difficulty breathing and will develop very specific spasmodic dry cough. Another group of allergens, those are what we call insect venoms, for example, bee stings. This type of allergic reaction is painful because those venoms hurt, and a lot of patients actually have allergic reactions to different insects, venoms. Medications. Antibacterials or antibiotics, common known as drugs or medications that cause allergic reactions. As an example, we can use penicillin. And the last group, those are food allergens. Food allergens. As an example, we can use peanut butter. You have to remember it's a very strong allergen, and also a lot of patients have allergic reaction to seafood products. Now, how do we diagnose allergies or allergic reactions? Today, of course, the most commonly used test, it's a skin test, and the main idea of this test is we apply small amounts of different allergens on the surface of the skin of patients, and if patient develops a rash around that area, that means reaction is positive. Uh, Although the skin testing is very accurate, but at the same time, it is a very uncomfortable test for the patients. And sometimes it's rare, but sometimes it also can cause anaphylactic reaction. So now it becoming more common to detecting immunoglobulin E's levels in the patient's bloodstream.